Hello, everyone. Welcome to today's scientific forum. So today we have two main topics to go through. So first of all, I have Changsu to give us a update and sharing on the manuscript progress, and then we'll have Nicole to share kind of the recent collaboration on SOS challenge. So without further ado, so Changsu, would you like to go first?
Yeah, let me quickly share our progress. Can I share my screen? So I and Sujin actually have started to write of the manuscript. For now, we just copied and paste our previous abstract into the draft, and we are also selecting figures and tables for the manuscript, and we'd like to set our due date for this manuscript at mid of June, and then we'll share it with the APAC community and finalize it by June. So maybe the last moment we can add more result from data partners would be officially this month. And I heard that an additional candidate database for including our study from the Singapore side. Then today is there morning here or
No, morning is not here. Izu is here. So like I do recall morning saying that that data is not going to be included in your what do you call the AMIA abstract, but he did want to be part of the study, right?
yeah, true.
Then maybe
then
yeah, after the call, how about you try reach out to
yeah.
morning? Yeah, sounds good. That sounds a good plan. Yep.
Yeah, I communicate with Molly and discuss about how can we edit their result into our study. So and for this manuscript, or you guys can see our work live on the MS Teams channel. So if you have any opinions or want to contribute, then please let me know, or just tagging me or Sujin. Yeah, we've started just right before, so maybe it takes, I think, a month. So yeah, that's our quick progress.
So guys, so Chungsu, the manuscript right now, you're drafting in real time in the Teams channel, right? Or are you working offline, or is it?
We are working online in the Teams channel.
Great. Then so everybody here, if you go to the Study for Teams channel under the APAC Teams, you can see the changes happening real time from Chungsu. So if you have any comments or any suggestions for Chungsu, I think it's you guys can chip in while he prepares the manuscript. Great. Sounds good, right? Yeah.
So Chungsu, would you mind just giving us a very brief description of the results you have so far? That would be very interesting.
I think the main point of this manuscript is the heterogeneity of the common data model in APAC region. We investigated the quite general aspect of database, but we also found that the proportion of some data or the ratio of mapping rate are quite heterogeneous across the database. So I think it would be great we can discuss this point in this manuscript.
Great. And how many databases, I'm reading here, how many databases did you end up reporting on?
I think it was about 25.
Okay, great.
Yeah. And we need a great target journal for this study. So yeah. Sorry.
Hello?
I think we lost you.
Hello?
Yeah.
I have a question for you, right? Typically when you write up a manuscript and submit to journals, if you have that that little catchphrase in the beginning of this type of study is a first of a kind of thing, right? Have you conducted any literature review on like similar studies on data quality or data profiling that that your study is doing, or is that something you guys need to see, right? I mean, review.
Yeah, I read some profiles about each cohort, but they are just focused on their own data, and I don't read much about how the descriptive analysis for the data quality across many databases. So I think it would be, I think it is quite a first thing.
That's good, right? That's
Yeah.
good. Probably, you can get a good journal to target for and get it published. Yeah, sounds good. Yep. Thanks for that. No questions from further questions from my side.
Yeah, and also I do have one quick question because I think for the abstract, can you hear me?
Yeah, sure.
Oh, okay. So for the abstract, we did, for the China data partners that we know for Wonders and that we did rerun something. And I think I remember back then you said there could be more for them to run. I don't know if that's ready or like, would you need that for this manuscript, or you have everything you need for the manuscript?
All the part of we need more than we can handle on this month, I think.
Or do you need them to run?
Maybe we need 1 or 2 rounds for additional data, I think.
Okay, yeah, just let me know. We can kind of support for that because I remember, you mentioned there might be more for them to run. I think they did run pretty fast, and then they did to do that for the SOS challenge. So just let me know. I just thought about that.
Yeah.
Cool.
They are hard workers.
Wow, they sounds good. Cool. All right. Any other questions for Changsu? Oh yeah,
Changsu, I just put a link in the chat. There's a special call for papers if you're looking for a home for your paper, pharmacoepidemiology and drug safety. They're looking for papers around research reproducibility, and the topics that they're including there are things like data access, data quality, distributed network analysis, things like that. So it may be a nice home depending on how you frame your paper, but it's coming up. Deadline is 30th of November, so fair way away, but you might want to go for a higher tier journal before that, but that's a potential backup.
Yeah, thank you.
So I have a quick question there. I was looking at figure 1, the distribution of records to person ratio in each domain. Is there a reason why we don't see normal distributions in the specimen and the procedure occurrence tables?
Oh yeah, that's a good question, because in the same type of data like EHR data, we can find some heterogeneity of distribution, like you mentioned, specimen or procedure occurrence. So we have to discuss in the discuss section more about, and I think we have some. I think in the process of ETL, some of database have lost some of data in that domain. So I think that was the reason for heterogeneous and very wide distribution of the specimen. So yeah, I think we need more think about it.
Yeah, that would be definitely, I think, of interest, like why we are noting this these 2 tables, and and also the source data perhaps might be something worth looking at. Source data that's used to generate this as well, whether there's some bias that's inherent in our source database system. Yeah. Otherwise, yeah, it looks good. I think it's coming up quite well. Yeah.
And
like something. Oh, go ahead. Sorry.
And I think the mapping ratio is quite a key reason for this heterogeneity, because most of databases have less ratio, have low ratio of that specimen or measurement domain. So I think it could be cause that heterogeneity of distribution, I think.
Yeah, something to add in line, right? Along to the line that Chungsu just said. I don't think right now, in Odyssey, we have much use cases on the specimen table, right?
Yeah, true.
Yeah, that's why maybe when people ETL their data, the specimen table is not really of a great interest. But of course, the procedure is it's frequently used, so maybe that's something that you do need to kind of think of reason, right, in your discussion section. So yeah, on specimen, I think, well, what I just said could be a potential reason. Yep.
All right. Any other questions? Cool. Thank you. Thank you, Chungsu. And next, so I have Nicole to give us a quick update on the collaboration for SOS challenge. So Nicole.
Yeah.
Thank you.
Yeah, thanks, Jing. So I just wanted to give a bit of an update of where we're at with two projects really that are both going on in in the area of multiple sclerosis. So most of you will know that the MS characterization study and treatment pathway study was one of the studies we're doing as part of the 4 APAC-led distributed network analyses that we're talking about here today. But there is also another MS study going on with the SOS challenge led by Tamir. I'm not sure if I've got the correct pronunciation of that. And what he's interested in is looking at the outcome of progressive multifocal, I can't say it, PML with multiple sclerosis after biologic medicines. So he's designing that study in the SOS challenge. And obviously there's a very large crossover between the two projects. In particular, the focus of the MS study for the APAC region is to look at, the trends over time in the change in therapy between the traditional approach to treatment to the new sort of highly effective injectable treatments. So that's kind of the focus, but Tamir's focus is around the outcomes of that treatment in terms of this really severe side effect just with the highly effective treatments. So we thought it would be a great idea to kind of merge together and join forces to get both of those projects moving along at the moment. So I think Tamir is also having a few issues getting people on board and getting people going. And I can see that Christine Liu is online. And Christine, I know you've had a fair bit to do with the SOS Challenge project as well. So I'm hoping I can maybe call on you for some help getting these two projects kind of aligned and moving forward. So Christine, did you want to give an update? I'm not so involved in the MS study for the SOS challenge, but do you want to give us a bit of an update where you guys are up to and the challenges and what we can do to kind of move things forward?
I might have to get back. Thank you very much, Nicole. Yeah. I'm happy to provide an update. Maybe next time. I just wanted to refresh on some of the situation and catch up with the group and make sure I have the same update to provide. But thanks for that. And I'll do that for sure.
Yeah, so I can see that there's a research protocol that's being developed for the PML study. And a lot of the cohort definitions in terms of exposure and definition of MS seem to be very similar. So we will, try to join forces and maybe make one protocol. But what I think I'm asking people online if there's anybody who would like to be involved in a smaller group, I think, just to help with the transition of these two projects into sort of maybe one project. So a small working group would be really useful for us to get together to kind of move this forward. So you don't have to sort of let me know right this minute, but I'll be reaching out to a few of you online and seeing if we can get this to happen. So
I second that, Nicole. I think that's
Yeah.
a great idea. Thanks.
Yeah.
I think especially some of the details, when I last looked at the protocol, I think there were still some details missing. Things like, defining as detailed as possible the washout period, those kind of things that would need to be nailed down before programming can happen. So that'd be great.
Yeah. So if anybody would like to put their hand up right now, that'd be great. But otherwise, I'll reach out to specific people, and you can always get in contact with either myself or Tamir as well.
Be happy to chime in, Nicole, if
great.
the time
Thanks,
works
Christine.
out.
Yep, perfect.
Hey, Nicole,
Sorry.
I have just one question, right? So based on what we talked about in our previous meetings, I think one of the issues or the challenge that you were facing was the drugs, right? Some drugs are, the way they are being administered is very difficult to define, and also the drugs being used in specific countries may differ as well. So is the MS SOS challenge also considering these heterogeneity in the same aspect, or would that be something that you would perhaps raise to the group and address together as a team, I guess? Yeah.
Well, I think in terms of the treatments, from what I can see with the SOS challenge, is that the focus is much more on the high efficacy infusion and injectable products, which are potentially a much narrower, group of medicines, and they're relatively new medicines. So I would imagine, there wouldn't be that much difference across the countries. Where we were getting in a little bit of trouble was with the traditional medicines like interferons and the older kind of medicines, what was available and what people were using. So there's certainly there could be some medicines that are used in some countries and not others, but I think we've got a fairly good list of the available medicines across different countries. How they use it, we don't know, which is why we need to do the characterization piece of work, because that will then inform us on how we should go about doing the safety study, right? So I think there's a very important step we need to do first, is really just that characterization. Who's using what, how they're using it, and how that would then inform us to do a safety study.
Great. Sounds good. So Asian people are generally shy, right? Nobody's gonna put their hand up. So I've left in the chat Nicole's email address. If you're interested, please leave Nicole a message, and perhaps we can create a small working group. Jane, can I speak on behalf of you, saying that IQVIA got Nicole's back on this as well?
We're being recorded. Come on, we're being recorded.
We'll reach out.
We will.
What I should say is that at one of the SOS challenges, when we did the feasibility tutorials, it was mentioned that there were about 10 different data sets that had signed up for the SOS challenge that were feasible to run the multiple sclerosis question.
Exactly.
So, it's not as big as the fluoroquinolone study, which has like 30 different databases, but, there's certainly enough databases that have put their hand up to do this kind of study. And I'm not sure the geographic locations of those databases, but hopefully it's sort of a bit of a spread across the APAC region, so that we can have a look at the difference in patterns of use and so on. So I think it will be a feasible thing to do. We just have to really work hard to nail down the target cohorts, and I think that's really the barrier that we're at the moment. How to define multiple sclerosis to start with, and then how to define the treatment. So if we can get over that barrier together, I think we'll have a very good study. All right, so that's it from me, Song.
Cool. Thank you, Nicole. Any other questions, comments? Or if you want to think about it and then email the group, email Nicole later as well, that would work.
Can I ask one more thing, Jing, while we're
Yeah,
online?
sure.
Yeah.
Mhm.
So thank you to all of those online. I can notice a couple of names for your abstracts submissions to the APAC symposium in Sydney. So hopefully you've all received your email notification and some comments that from the 2 reviewers. So thanks so much. We had a really great submission. We had a lot of submissions. We were really, really pleased about the interest. So if you haven't got an email, let Song know. But Song, I think you've sent everything to everyone. Is that right?
Yeah, except for the ones that came in a bit late. I'm still coordinating for the review of those. So
yes.
And guys, like really, like I think Nicole is really appreciative of how much the submissions came in. She was panicking a bit on figuring out where to place the posters and everything, but I think we got it all figured out, right?
Yes. Yeah, no, we're going to have a great meeting, and you know, we've got some poster boards and some breakout spaces in a nice sort of atrium area, so we'll have a nice forum to discuss our research. And we're also working on the agenda, and we're hoping to get a poster walk or some lightning sessions sort of fitted into the program as well, so that you can showcase all of the great work that you've presented. So I'm really looking forward to it, and thanks everybody for submitting. It was really interesting. I was really interested to see the depth of the work going on in APAC and the different stages of OMOP development and use of Odyssey across the different countries as well. So I think we've got a very nice breadth of research that's going on. So really exciting.
Yeah, so guys, since we have a lot of you who submitted in the call, right? So one administrative logistical request, right? Please print your posters to be at maximum 100 centimeters wide. So Odyssey poster templates are a little bit larger than that. If you choose to print at 100% ratio, you guys will have hanging posters at the sides. So please reduce the ratio. I'm pretty sure the printer, like those little printer companies, can adjust the ratio when they print it. So please,
so
it's an important thing.
1 meter wide only.
Yep. So the height, it's not a problem. It's just the width that's the problem. So yeah, one last request, and I have no further comments.
And please register as well. So the registration is open. So go ahead and register. And yeah, it'll be fun to have you all.
Cool. Thank you. Thank you, Nicole. I think that's all we have for today's call. If no more questions, well, thank you everyone for joining us today, and we'll see you in 2 weeks for the community call. Thank you. Have a nice day.
Bye everyone.
Bye, guys.
Thank you.
Jing, do you want to stay on this call?
Let me stop recording, guys.